The moment you first open a potential surrogate's profile, it is almost impossible not to feel a sudden rush of anticipation. A profile is rarely read as pure objective data. Instead, intended parents use these summaries to actively imagine a child, picture a delivery room, and visualize a clear path forward. That deeply emotional response is natural. However, moving forward on hope alone and treating this introduction like a race often leaves critical logistical gaps unaddressed. When a match is rushed before pregnancy histories are vetted or insurance exclusions are understood, that early momentum can stop abruptly. Without this groundwork, the journey often encounters avoidable medical delays and unexpected financial liabilities. To survive the reality of the process, a sustainable match must be constructed on a rigid foundation of structural review and clear expectations before any emotional attachment takes root. We begin this construction piloting past the summary and moving into the first structural pillar, the surrogate's medical history. Before you invest your heart, you must invest your attention into her past pregnancies. You need to verify a record of healthy deliveries and carefully check for the absence or presence of prior complications. The delivery history dictates how a clinic will evaluate her candidacy. Factors like prior C-sections, the gestational age at her past deliveries, and her postpartum recovery timelines are the metrics that determine medical readiness. A brief profile summary cannot provide this level of detail. To gain true clarity, actual, complete medical records must be gathered and thoroughly examined. This chart shows how responsibility is divided. While EDSI focuses on structuring and coordinating these records, the final medical clearance is handled exclusively by your reproductive endocrinologist and fertility clinic. Clinical data is only half the picture. A successful journey also requires immense logistical stability in the surrogate's daily life. We have to evaluate the practical factors that dictate operational readiness. Does she have reliable transportation? Is there available childcare, family support, and a work schedule that accommodates appointments? Beyond physical logistics, her emotional readiness and habits around communication are just as vital to the structural integrity of the journey. This decision tree maps out the financial pillar. We evaluate the surrogate's insurance early to determine if her policy is usable or if specific exclusions will trigger the need for additional coverage. Rigorously evaluating these daily logistics and financial realities early on prevents the journey from being derailed by unforeseen everyday stressors. The final foundational pillar involves making sure both you and the surrogate are walking the exact same operational path. You must align on logistical preferences, such as how frequently you plan to communicate, her willingness to travel, and the specific plans for the embryo transfer. Then, you must address sensitive emotional expectations. This includes who will be present in the delivery room, how medical decisions are approached, and the boundaries for post-birth contact. This timeline illustrates how we protect that alignment. We treat legal coordination and attorney-guided agreements as a prerequisite that occurs before the match is finalized, rather than as a reactive step later. EDSI manages the timing and framework of this phase to maintain momentum, while qualified reproductive attorneys provide the actual legal advice. This level of vetting is not meant to create anxiety. The goal is to eliminate the surprises that cause friction later in the process. A resilient surrogacy match is the result of resolving difficult questions and setting honest boundaries before an introduction is ever made. By grounding the relationship in technical records first, you allow the emotional bond to grow on a stable surface. Matching will always be a deeply personal milestone, but ensuring both emotional and operational alignment up front guarantees a safe, unrushed journey. Before you agree to a match, you should know exactly what has been reviewed and confirm that every structural pillar is in place. Donor Surrogacy Institute can help you navigate this process. Reach out to EDSI to move through surrogacy with structure, clarity, and care.